My name's Christine Shearman. I'm a radiologist supervising in breast imaging at Sydney Adventist Hospital. So the mainstay of breast imaging for women over approximately 40 years of age is mammography. Mammography is a special x-ray of the breast and most women over 40 need a mammogram as their initial examination. The other investigation that's commonly used is ultrasound, breast ultrasound. In the younger women, we tend to use that as the first line method of imaging, but women over 40 often need a mammogram and an ultrasound. There are other important imaging techniques that are used, such as biopsy with both ultrasound and mammography, and also in various cases we will use MRI to image the breast. So mammography is usually, as I said, for women of approximately 40 years of age. It uses a fancy x-ray of the breast to image the breast to identify breast density, look for breast pathology, and it can both screen a woman who's asymptomatic as well as investigate a diagnostic question such as a palpable mass, a lump or bump that a woman has, and so forth. Breast ultrasound uses different physics. It uses ultrasound technology. It's not radiation to the breast. It looks at the breast in a different way, so it is a complementary examination. MRI is again a different technology using big magnets that acquire imaging through rapid changes in application of a magnetic field to a woman. So they're very different physics principles to image the breast in different ways. So mammography has traditionally been a 2D imaging technique of the breast, what we call 2D imaging. Mammography is a single image obtained in two different directions of the breast, and we take two views of each breast. But now our new unit has a very fancy type of mammogram called tomosynthesis, and that's also known as 3D imaging. And it is a method of acquiring lots and lots of slices through the breast, so to speak, so that the radiologist can then look effectively at a video. We can scroll through the breast and look at lots of little slices through the breast. The benefit to the woman in terms of her experience is no different. It's just like having a mammogram, but the benefit to the woman and the radiologist in terms of diagnostic capability is enormous. The analogy would be like looking at a cake, the breast being the cake. In the past, we've taken a photograph of the cake in two directions and tried to work out what's going on, and now we're actually slicing up that cake, and we can actually look at the slices of the cake all the way through and work out whether it's a chocolate cake or a marble cake, and we see it a whole lot better. The other advantage with this new unit is we can do what's called contrast mammography, where we give an injection of X-ray dye and then we take images of the breast. And that's opening up a whole new realm for us of diagnostic capability and diagnostic accuracy, and that's a really evolving and exciting new area of breast imaging. The SAM's got everything possible to offer a woman who has to have breast imaging. We've got every capability now. We're able to perform breast density evaluation, which is very important. We're able to perform 2D and 3D mammography with the ability to biopsy in multiple different directions. We're able to do ultrasound, which is able to assist the younger woman in initial evaluation as well as the older woman. And we're able to perform contrast mammography and MRI. So we have the full gamut. We have radiologists who are expert in the field of breast imaging. It covers all bases.